Picture your typical morning routine, right? You wake up, pour yourself a fresh cup of coffee, maybe toast a bagel, or grab a glass of grapefruit juice to start the day off right. Then, you take your daily medications. You're doing everything you're supposed to do to stay healthy. But what if I told you that your everyday breakfast might actually be acting as a secret agent, literally chemically sabotaging those very life-saving medications you just swallowed? Welcome to our explainer today. We're going to uncover the hidden, microscopic battles happening right inside your body when what's on your plate collides with what's in your medicine cabinet.
So here is the roadmap for our investigation today. Number 1. When food fights medicine. 2. The absorption tug-of-war. 3. Metabolism and secret saboteurs. 4. Recipe for disaster. And finally, 5. Your safety playbook.
All right, Section 1, when food fights medicine. Okay, let's dive into this. The biggest myth we need to bust right out of the gate is this idea that healthy food is always good for you. When it comes to prescription drugs, context is absolutely everything. What's really interesting here is the specific language we use to define food-drug interactions. It's a bit of a mouthful, I know, but I want you to focus on two distinct outcomes here: increased toxicity and reduced therapeutic effect. We aren't just talking about a mild stomachache. We are talking about a literal chemical clash inside your body, where a simple beverage or a supplement can either strip a drug of its healing power entirely or dangerously amplify it until it becomes toxic. Your digestive system basically becomes a battleground.
Which brings us to Section 2, the absorption tug-of-war. Let's look at the first major conflict area in this microscopic war. Think of your digestive tract as this high-stakes tug-of-war, where food can either steal the medication away before it even enters your bloodstream or, surprisingly, act as a powerful ally. Let's see how this builds our understanding of absorption. On one hand, certain foods completely block your body from absorbing medicine. Take antibiotics like tetracyclines or fluoroquinolones. If you wash those down with milk or eat a bowl of yogurt, the calcium in those dairy products physically binds to the drug in your stomach. It creates this massive complex that is simply too large for your body to absorb, effectively making your antibiotic useless. But on the flip side, the exact opposite is true. If you take the antifungal drug, griseofulvin, it actually demands a fatty meal to be absorbed properly. Or take carbamazepine. Taking that with food not only boosts its absorption, but keeps it from irritating your stomach. It's a really delicate balancing act.
To really drive this home, look at these extreme blockers and boosters. Levothyroxine is a super common thyroid medication, but if you take it with your morning coffee or any soy products, you are significantly reducing its power. It just gets neutralized. Then you have bisphosphonates, like alendronate, used for bone density. If you eat literally any food with this medication, its absorption is completely ruined. You get absolutely no benefit. But then, acting like a secret agent that actually feeds on your breakfast, you have the antibiotic nitrofurantoin, which gets a massive absorption boost when you eat. Knowing which category your drug falls into is the key to it actually working.
Moving right along to Section 3, metabolism and secret saboteurs.
So, we've seen what happens during absorption. But what happens once the drug is already in your system? This is where foods can act like biological hackers. I want to pause here and ask you a direct question. Think about grapefruit juice. It's packed with vitamin C, it's a staple at healthy hotel breakfasts everywhere, and it seems totally innocent. So why on earth is this specific juice considered an absolute menace by pharmacists around the world?
Well, here is the incredible science behind it. Grapefruit juice actively inhibits a specific enzyme in your intestinal tract and liver called CYP3A4. Normally, this enzyme is responsible for breaking down a massive variety of drugs. But when grapefruit juice shuts this enzyme down, drugs like cholesterol-lowering statins, think simvastatin or atorvastatin, or blood pressure medications like amlodipine, they simply can't be broken down. They get trapped. They build up in your bloodstream, leading to increased drug levels and severe toxicity. A totally healthy breakfast drink literally turns your medication into a toxic trap.
And this brilliantly illustrates the cruel irony of food-drug interactions. Sometimes the healthiest foods are your biggest enemies. For instance, cruciferous veggies like broccoli and Brussels sprouts actually induce or speed up drug-metabolizing enzymes, clearing some medications out of your body way too fast. Then you have the classic interaction: warfarin, a blood thinner, working against vitamin K-rich foods like spinach and kale. Eating those healthy greens dramatically reduces the drug's anticoagulant effect, spiking your risk of a clot. But I need you to pay very close attention to this next one. This is serious. If you're taking an MAO inhibitor for depression and you consume tyramine-rich foods, which is basically a charcuterie board of aged cheese, cured meats, and wine, it can trigger a massive, sudden spike in blood pressure known as a hypertensive crisis. This is a severe, life-threatening emergency caused simply by pairing the wrong dinner with your medication.
And that brings us to Section 4, Recipe for Disaster. We're shifting into the most critical category of our explainer today. These are the adverse effects where drugs and drinks actively team up to cause immediate harm to your body.
Unsurprisingly, the biggest culprit here is alcohol. When you combine alcohol with central nervous system depressants, like benzodiazepines, opioids, or even common antihistamines, you aren't just getting a little sleepy. You are risking excessive sedation and severe respiratory depression, which means your breathing can dangerously slow down or even stop altogether. Then we have metronidazole, an antibiotic. If you drink alcohol while taking this, you will experience a disulfiram-like reaction. We're talking violent flushing, severe nausea, and uncontrollable vomiting. It's awful. And finally, combining alcohol with everyday over-the-counter NSAIDs like ibuprofen massively increases your risk of tearing up your stomach lining and causing gastric bleeding.
So the crucial point is right here on this cheat sheet. I highly encourage you to take a screenshot of this right now. It covers everything we've talked about and introduces a few novel interactions you absolutely need to know. Notice how high-fiber meals, again, something we think of as incredibly healthy, can actually reduce the absorption of the heart medication digoxin. Look at iron. If you take iron supplements with tea, coffee, or calcium, you ruin its absorption. But if you take iron with a glass of vitamin C-rich orange juice, you massively boost its absorption. And if you're on ACE inhibitors for blood pressure, watch out for potassium-rich foods or salt substitutes, as they can cause hyperkalemia, which is a really dangerous spike in your potassium levels.
Okay, Section 5, your safety playbook. With all of these traps and hidden interactions, how do we eat safely? Let's build your actionable, practical playbook so you can navigate the dinner table with total confidence.
The very first thing you need to burn into your memory is the golden rule of separation: 2 to 4. If you are taking drugs like tetracyclines, fluoroquinolones, or levothyroxine, you must separate them from calcium, iron, magnesium, or antacids by at least 2 to 4 hours. Give your stomach a window of 2 to 4 hours to safely process the medication before introducing those binding minerals. Let's walk through the rest of this prevention sequence step by step. Step 1 seems super obvious, but it is routinely ignored. Take your medicines exactly as directed. If the bottle says on an empty stomach, it means on an empty stomach. If it says with food, eat food. Step 2, as we learned, avoid grapefruit juice and alcohol entirely if you are on susceptible medications. Just don't risk it. Step 3 is all about consistency. If you take warfarin, you don't necessarily have to ban spinach from your life forever, but you must maintain a steady, consistent intake of vitamin K so your doctor can dose the drug accurately. Don't eat 0 salads one week and 5 salads the next, you know? And finally, step 4, always consult a healthcare professional before adding any herbal products or dietary supplements to your routine, because natural does not mean safe when mixed with prescriptions.
So we come back to where we started. Are the everyday ingredients in your kitchen secretly acting as saboteurs? The food we eat does so much more than just fuel us. It interacts chemically with everything we put into our bodies. I encourage you today to go check your own medicine cabinet, read those labels, look at the warnings, and most importantly, respect the chemistry of your diet. Knowledge is absolutely your best defense here. Thanks for joining me on this explainer, and stay curious.